Hi, my name is Maddie Nance. Today I will be reviewing a second article in relation to my NICU education project. Again, for my project, I have been working alongside my nurse educator in the NICU to improve emergency response training in our staff nurses with both mock code sessions as well as new graduate internship courses as well. With this, I have been also creating what we call badge buddies, which are essentially a small resource tool that all of the nurses can have on their badges. So these badge buddies have a checklist of our unplanned extubation bundle, and I am trying to reinforce and implement this to reduce the unplanned extubation rates in our NICU. I have found that other safety bundles are more accessible on our unit. However, the unplanned extubation bundle needs more attention and accessibility to our staff nurses. So, for the article that I am reviewing this week, it is titled Outcomes of Unplanned Extubations in a Large Children's Hospital. So the article reviews unplanned extubations in three different pediatric units. So the pediatric ICU, the cardiac ICU, and then the neonatal ICU, all during a period from 2016 to 2021. So the article found that the NICU actually had the most amount of unplanned extubations compared to the other two units, with a total of 325. And this is compared to 52 in the pediatric ICU and then 31 in the cardiac ICU. Overall, there were 408 total unplanned extubations during this study period during the article. Mortality rates were 18% for those who experienced an unplanned extubation, and other complications included desaturations, of course, bradycardia events, and chest compressions. The article goes on to talk about the importance of recognizing that unplanned extubations are preventable adverse events in our hospitals. So the article specifically addresses that unplanned extubations are seen more often in the NICU. And something we don't think about is obviously it's probably due to their smaller size. So being less than 2 kilograms, the article addresses that these patients are more at risk, and also the use of or the low use of routine sedation. A lot of our providers do like to keep our NICU babies not completely sedated, so that they're still able to do some of the work on their own and still be more active for our ventilator weaning readiness. And then also the article looked at high rates of unplanned extubations were seen during care activities such as retaping the ET tube or just general nursing care activities. And these are also things that I have noticed on our unit and hope to address further with my safety bundle with my project. So for my project, I am hoping to highlight to the staff with my Badge Buddy bundle and checklist the importance of following protocols for our intubated patients and that unplanned extubations are preventable like this article addresses. The checklist I have highlights things related to a website that our hospital uses and refers to, which is called Solutions for Patient Safety. And so things that I'm hoping to include on my bundle are things like gentle reminders about repositioning, and retaping always requires two caregivers, addressing sedation, obviously multidisciplinary rounding, ET2 measurement, and guidelines for this, and then emergency equipment to have prepared at the bedside just in case. Again, overall, my hope is that my project will increase staff education regarding how to respond during an emergency, like an unplanned extubation, with the trainings that I've been doing, and then also with the badge buddies to better enforce staff education to prevent these adverse events. Overall, I thought this article addressed the importance of implementing protocols and staff education to improve patient outcomes. Thank you for watching my second video discussion.